Hi, I'm Dr. Munshi. In this video, I'll talk about how to prevent mucormycosis infection in post-COVID-19 patients and patients with uncontrolled diabetes mellitus, immunosuppressive diseases, cancer patients, and patients with organ transplantation. Let's start. The main risk factors for this mucormycosis disease are diabetes mellitus type 2, immunosuppression, neutropenia, metabolic acidosis, leukemia, lymphoma, that means blood cancer, and organ transplants. So these groups of patients are in high risk. The clinical presentation can be pulmonary, gastrointestinal, cutaneous, and disseminated. However, the most frequent presentation is rhinocerebral with a high mortality rate. That means it may affect your lung, bowel system, skin, and throughout your body. And most common is rhinocerebral. That means it can affect nose, sinuses, and brain. Now, what we have to do for preventing this mucormycosis disease? First of all, we have to use steroid judiciously in correct timing, correct dose, and duration. So for patients, do not self-medicate. Do not take steroid on your own. If you needed, doctor will give you steroid in correct time and with proper dose. So do not self-medicate. Take proper doses prescribed by your doctor. Second important is control hyperglycemia. If you are a patient of diabetes mellitus, you have to control your hyperglycemia. It is very much important. Control your blood sugar level by medicine, by exercise, by dieting. If your blood sugar level is not controlling by yourself and with your previous medication, just consult with your endocrinologist or your doctor. Now, third important is monitor blood glucose level post COVID-19 discharge and also in diabetes. So, if you are a post COVID-19 patient and you are in diabetes patients, then you have to measure your blood glucose level in regular interval. But also, if you are not a diabetes patient, if you took steroid during your hospital days, during your COVID-19 time, your blood sugar level may high because steroid increases blood sugar level. So you have to also monitor your blood glucose level after discharging from hospital. And whenever you find that your blood glucose level is high, you have to talk to your treating doctor. Now, fourth important is post-COVID health checkup. Whenever you are in trouble, whenever you are feeling bad, your headache, sinus pain, pain below your eye, blurry vision, nasal discharge, black or red discharge, any dental problem also, it is an indication or warning signs for mucormycosis like sudden loosening of tooth, any oral ulcerations, anything happen, you have to just go for a health checkup immediately. Do not delay. Now, use clean and sterile water for humidifiers during oxygen therapy. Use antibiotics and antifungals judiciously. Do not self-medicate any antibiotics or antifungals. Take it when it is needed. Use masks if you are visiting dusty construction sites. So after discharging from hospital, you are normal, it is okay. But if you are visiting any dusty site, you have to wear masks definitely. Now wear shoes, long trousers, long sleeve shirts and gloves while handling soil, moss or manure. And maintain personal hygiene including thorough scrub bath. It is very important. It includes your dental hygiene also because many of the early sign and symptoms, it may be your oral manifestations, it may be loosening of your tooth, sudden dental pain, any ulceration in the palate, cheek, in tongue. So you have to brush twice a day, you have to mouthwash with betadine gargle regularly for 2 to 3 months. Do not miss warning signs and symptoms. As I mentioned earlier, warning signs are sudden headache, blurry vision, nasal black or red discharge from your nose, redness below your eye, swelling of your eye, the just below your eye, or in the sinus region, and any dental pain, oral ulceration, anything you feel abnormality. These all are warning signs for mucormycosis, especially if you are a patient of diabetes mellitus, especially if you took steroid for long days and suffering from severe COVID-19 patients, you were admitted in hospitals for long days, and you were after discharging from your hospital, you have these warning signs. Then definitely you have to consider that it may be mucormycosis, and you have to immediate contact with your healthcare provider. So these things you have to maintain. And last but not the least, last thing that you have to maintain, that whenever your doctor suspects that you have mucormycosis and doctor prescribe any investigations like KOH staining or other culture, etc., you have to do it immediately. Do not hesitate. So these all things will prevent mucormycosis. Mucormycosis is a rare disease, but it is a fatal. So early diagnosis, early treatment, it is necessary for your this for overcoming mucormycosis infections. Thank you very much for patiently listening.